And we are live. I'm excited to come on today and talk about the ways in which we can honor all those heroes in healthcare that have gotten us through the pandemic, the scientists that have helped us with vaccinations. And let me tell you, working with the great people at National Institute of Health and the CDC and so many healthcare facilities around the nation, it has not been an easy ride, not just because of what the pandemic brought, but all the other factors that people have dealt with. So I'm going to wait for some folks to join us, and I want to talk today about honoring our healthcare heroes, and that it needs to go beyond just saying thank you and acknowledging what's happening. It really needs to involve some deeper and bigger things. So tell us where you're from as you come on. We're just gathering people together in these first couple of minutes. Let us know who's here, where you're from, and if you're in healthcare, that would be amazing to know as well, who all is joining us from a healthcare setting. So as you come on, I am so looking forward to our healthcare summit tomorrow. We are having a summit that's open to the public that is going to talk a lot about not only how do we honor, but how do we make sense of what happened to us, and how do we move forward and make sure we don't waste this experience. The best way to honor folks is to make changes based on what we saw, what we experienced, and making sure that there's additional support going forward. So there's still time to sign up for the Healthcare Summit. It's tomorrow. I'm sure Sarah will put a bunch of links up for us on the chat, but it's open to the public. It's going to be a great gathering of people from all parts of healthcare, all positions, whether you're a team member, whether you're a leader. It's going to be an hour and a half. We're talking about resiliency and well-being and readiness, and how to really make sure that we're tending to the people involved, and giving you also some techniques for how to emotionally support people now and going forward. So Joyce is on from Dallas. We met when I came to speak at the LD for their organization. Fantastic. Toronto, not in healthcare, but incredibly grateful for everybody working in that world. It has been a tough one. All of our essential workers, whether it's been healthcare or people out in the trenches, making sure we have what we need. Awesome. Michelle's on. Good to see you, Michelle and Pam, and good. So many familiar faces. It is Nurses Week in the States. I'm not sure in Canada or other places. It is Hospital Month. May is just a time where so many of the associations that are involved in healthcare, all the vendors, people like myself, really pay attention. And even though we should be honoring and thanking all year long, all the people in our lives, it's a time we really try and take a break and get really intentional about honoring folks. And so I reached out and asked many nursing friends, leaders, physicians, people that work in different places in healthcare, environmental services. And I just informally asked them, if we were to honor you, like, what helps? What would that look like? And it was surprising to me because there's a lot of appreciation for the many things that we've done for them back even early on in the pandemic, when we thought this wasn't going to last that long. And people each evening were gathering and, giving shouts and song and, making a bunch of noise to let everyone involved in the pandemic, whether it was our EMTs and paramedics and our fire and our police and all those frontline workers, just letting people know that they were thought of and they were remembered. And that was one thing that was mentioned, was it's just nice to know that people, even though they might feel helpless and can't really understand what it's like, that they at least are acknowledging that it's not our favorite, that it's tough, that it is bigger than what we signed up for. And so very grateful for all the things people are doing. They said things that really were touching for them is that people had gone on to like public sites and given like rave reviews, because so many times, people are choosing healthcare today. In the future, they've stayed away for now, but choosing healthcare based on those reviews. And that was a surprising thing. They said that their community really came together, did a ton of shout outs on social media, and did great job of like going to their sites and giving like really personal reviews, especially those who had gotten care. It's so important for us as leaders in healthcare to really make sure that the detailed stories, not just the thanks, the really specific stories get from patients and families and community members, even if you've just called in to get support to know what you should do next, that those things hit the airways and get down to the team involved. And so they talked about people bringing food. Somebody talked about somebody that during the winter, like knitted scarves and would just drop off these like crazy cool scarves in a basket at security for healthcare workers that, were having trouble finding rides to and from work and were walking in the city. They gave me a lot of ideas on like gift baskets and food and thank yous. But I want to get beyond that. Those are all fantastic. And I hope that you're having lunches and celebrations and honoring people in those maybe more obvious ways. But here's what I wanted to come on and talk about, because what I heard is the most honoring thing that we can do for our healthcare workers is give them an avenue to talk about what it was like for them specifically. Now, this is in line with the research. Pauline Boss talks about ambiguous grief. And there's been plenty of trauma and grief. People that work directly with COVID patients have just never seen the number of deaths ever that they saw day after day after day on some of those units. That's some obvious grief, right? That they're around major loss, but there's this thing called ambiguous grief, where you lose subtle things, where you lose things that aren't always named. So like a divorce is kind of an ambiguous grief because you lose a partner, but it's ambiguous because most people don't know, like, should I go, yay, you're out of that? Or are you sad about this? And so one of the most important things we can do to honor healthcare heroes is not assume what their life has been like, but just ask, what was it like for you? Or what's it like for you today? And listen. So as the world is opening up and you're connecting in with relatives and, just happen to be sitting by people at a concert or wherever you're going to be gathering, to allow people to, however much they want to, share their story. What meaning did it have for them? What was it like for them? What people are saying is we've rushed through and we've just dealt with the crisis, but there's like a lack of processing going on. And they really want to process, and they're really concerned about their own mental health and their own well-being and the well-being of others. And so that's one thing that surprised me when it came to honoring folks, is how can we have some listening circles that just, instead of maybe for Nurses Week having presentations, let's have like listening circles where people can really talk about what it was like for them. Now, for those of you in healthcare, as we're going through this, hi, Sherry from Stevens Point, Wisconsin. For those of you that are in healthcare and want to understand like how to honor, and even those of us not in healthcare, another important thing came up, and they said, the best way you can honor us, we love the thank you and we love the cheers and we love the food and we love all this. The best way you can honor us is believe the science. Get vaccinated, wear a mask, take care of yourself, stay home. is probably the most disheartening thing for many of the people I talk to is their stories that they're camping out so that they don't go in and infect their own kids while people are, you know, continuing on with behavior known to spread the virus. It was just so unsettling to them, and it felt so dishonoring. And so when I asked, like, what can people do, a lot of it was like, you don't have to thank me directly, just change your behavior, just take a look at what we've learned and be willing to do a small part for the greater good. And they imagine a world that we really could just watch this flux of this virus, and as cases went up, that we would all be willing to be more limited in our own behavior. And as cases went down, we would enjoy that freedom as well. That they wanted partnership. They felt like their communities and sometimes their community leaders weren't partnering with them as they were, you know, trying to work through a pretty big crisis. And so for those of you in healthcare as well, in the spirit of what has this pandemic revealed to us and what do we know and how can we honor, not just in the thank yous, those are necessary, but in the world we curate next, what have we learned and how are we going to learn what this has revealed to us and move forward? Later today, I'll be talking with some folks in Minneapolis healthcare who not only dealt with the pandemic, but their hospital is in the neighborhood where George Floyd was murdered and where all the protests and riots happened. And, you know, they've just had trauma after trauma after trauma. And as I try to understand, like, what would be most helpful for them, it's so important for us. Hey, Kim, good to see you. What's so important for us is to not let this experience go to waste. And as human beings, we have a tendency to do this. How many of you learn a huge life lesson and wake up and it's a big awakening and then fall right back to sleep and go back to your old ways? And I have another big awakening, wake up, fall back to sleep. That's the worry here, in that we have learned so many things about our state of the world, about racial and social economic inequities and lack of justice and lack of access. And so the big ask, if you want to honor healthcare heroes beyond Nurses Week and beyond the month of May, is help us commit to taking what this pandemic has revealed to us and changing and creating a different workplace and a different world place. And so what does that mean? It's different for some of us in healthcare and outside of healthcare. But when I studied resiliency, which, by the way, has gotten weaponized, it breaks my heart, because resiliency isn't heroics. Even though we have heroes, resiliency isn't muscling through. Resiliency isn't handling things that are almost inhumane. That's resiliency isn't that big. Resiliency is the personal ability to bounce back. It's the ability to emerge from traumatic situations, evolved and impacted, not necessarily traumatized. It's the ability to stay the course in hard times. But resiliency is not about heroics. It is not about being superhuman. It is not about putting yourself into a situation of burnout and undue risk. Resiliency is fueled on the individual level, not by heroics, but by increasing your capacity, which has to do with your daily habits and dedications. So for those of you feeling burnt out, this pandemic and all that came with it during this last year has revealed to us what is the state of your habits and dedications. It is very difficult to start eating well, sleeping well, unhooking from your ego through meditation, moving your body on a regular, habitual basis in the moment of crisis. Those are things we need to do so that when crisis hits, we have an increased capacity. We already have a foundation. So if nothing else, for all of us, for our own mental health, what this pandemic has revealed to us is that many of us don't understand how our mind works, and they don't understand how the world works. And we were caught with so many team members and human beings, underskilled in managing their own anxiety, in understanding how their mind works, in um, being able to feel their feelings, but not trust their feelings, being able to understand when feelings are out of proportion to a situation, that you're adding in stories. So, one of our next pieces of work in every school system, every employer, is not just well being programs, but bringing back into leadership, bringing back into all of our development programs, people's basic skills in teaching people cognitive behavior therapy techniques, DBT techniques, teaching people true self-care, because what a lot of people have relied on during the pandemic is self-numbing, self-soothing, binge watching Netflix rather than self-care. And many of us as human beings have outsourced our self-care and expecting our environments to be such that we don't need much self-care, instead of ensuring that our habits and our spirituality and that our lives have containers solid enough to be able to withstand some of these hits. We also need to teach people that resiliency isn't heroics. What we found out about resiliency in our research was that resiliency was a lot about the number of positive relationships you had, the number of connections that you had that were positive. This means that you're connected to people in meaningful ways. This means that you have not been a scorekeeper and only done your fair share. This means that you have been available to help and to teach, and that you've kept yourself involved in the whole energy cycle, not just doing, let's say, patient care or, dietary services, but feeding yourself by teaching and mentoring others, and also interning, meaning being a student of life and learning. The energy cycle that allows us to give more is all about being connected in and interning, learning, being part of our industry, but also connecting in and being willing to mentor and teach. It is the interaction, that human connection together, that makes up resiliency. So the most resilient people anchored their confidence not in I'm the smartest person in the room, not in I'm the best at my job, but they anchored their confidence in no matter what, together, collectively, we're genius. Collectively, we might not know the answer, but we can figure out approaches, and we're vulnerable, and we're willing to try some things and learn from them, and take risk and be exposed, but we're safer together collectively. Hi, Gloria from San Diego. And oh my gosh, brings back memories of the New York City days. Good to see you. It's so fun. Good. I'm glad that so many of you are here. We're going to talk a lot tomorrow about resiliency, but resiliency is the individual piece, and resiliency is what we need to use to offset readiness or lack of readiness. So the sweet spot going forward, the honoring of many, is that as organizations, we need to pay attention to readiness, making sure that we are ready, and we're not just focused on change management, but that we're focused on building readiness. And readiness is a forward facing piece of organizational work that we need to do. Readiness is bigger than change management. Readiness is keeping a constant state of readiness so that when disruption comes, we greet that with our readiness, and what we couldn't predict is offset with resiliency. Organizational readiness and resiliency, where they meet in reality, if both are high, that's the sweet spot. We don't burn our people out, and we are continually improving in order to maintain readiness. And I talk about that a lot in my my No Ego book. But what we're finding is the organizations that came through with a little less burnout were the ones that were more ready. Now, readiness, the number one thing for readiness is that people were willing to have things automated, so that the connections for information were automated, like in the medical records, so that the connections to the patients and to each other for mentoring and interning and healing were left up to the humans. And the biggest thing that aided readiness and resiliency was standardization. So many of the people who are now telling me they're very burned out are the same people that fought standardization for the last 10 years, because what resilient people know is they aren't willful, they're willing. They're willing to forego their preference for a greater potential. They're willing to not just do heroics when the patients show up at the door, but they're willing to do a bit of heroics for the greater good, just like they want us to wear masks for the greater good. Being willing to have your processes standardized and have evidence-based, practice is so important. And there's a comment up there about self-care, me time requires intention and discipline and some selfishness. Absolutely. And it also implies what I would call evidence-based, like restoration. Like in mental health, we know, we have evidence-based practices that this will help you restore and rejuvenate, and this won't, that this will build your resiliency and this won't. And we really need to get people to share accountability in building that resiliency of their own. It needs to be almost a new requirement. We've come down to requiring heroics, but we need to require that part of being a professional is the ability to show up as an involved person who really tends to their own bodies and their own minds and their own selves. So, and resilient people can say, I'm willing to change my ways, to not be willful, but to be willing, in anticipation that anything we can standardize and anything we can automate will free us up to handle even greater disruption in creative ways. And resilient people, they knew that the genius was in the collective. And what we do as human beings when we're stressed is we isolate. We tend to want to intellectually think our way out of something. We tend to make our world smaller. The last thing you want to do when you come home and you're feeling like you're really struggling is reach out. But there's so many counterintuitive things that we need to do in order to set ourselves up for success. And it's almost like we need a list of those things for folks to just go down the checklist. Have I done this? Have I done this? That's actually what I do for myself to keep my resilience high, is when I start to find myself a couple days in a row having anxiety or feeling just down or feeling funky. Not that I'm not okay with those times of feeling funky, but I have to ask myself, have I been meditating? Have I moved my body? Have I been out in nature? When's the last time I actually connected with somebody and said, hey, I'm feeling funky? And all of those things are the last things we want to do, but we almost need to remind ourselves to do those. So honoring is really about mining these experiences for what's been revealed to us about the well-being and capacity of those who work with us, about what's been revealed to us in our systems. Where did we make so many exceptions that we allowed for willfulness that then kept us from being able to quickly mobilize and standardize? What have we learned about how we need to work together differently, how we need to adopt new ways and technology, how we need to reach out to communities, especially communities that are people of color and other populations that are not feeling comfortable accessing us preventively? How are we, when we're working with making decisions and the metrics we're measuring patient experience, we're measuring safety, we're measuring outcomes. How are we measuring well-being of the people that are providing this care? How are we ensuring that, yes, nurses, yes, physicians, yes, care techs, but all the other support people, how are we ensuring that that they're tended to and cared for? Many of our organizations used to start every meeting. So many of the healthcare organizations were faith-based with reflection and contemplation and a lot of safe places to break into, not theft-wise, but to take a break in. And when you look at the physical layout of many spaces, those are dwindling. Those times of reflection are dwindling. Those moments of pause and restoration are dwindling. And we need to, think about that when we huddle every morning and we talk about what we can do next for the patient. Are we talking about what we can do next for each other? And it's so important that people realize that one of the biggest ways to move through tough times is connecting with peers who have a shared experience, but doing it in a way that is supporting and dreaming of multiple positive outcomes and talking about hope and sharing experience and offering solutions and help, not venting. And what I see right now is people are coming together and they want meaningful connection, and it erodes into venting and ain't it awful and some complaining. And while immediately that might feel better, it's a behavior not that will certainly connect, but it connects us by separating us out from a common enemy. And that's not true connection. Connection should connect us to each other, to a greater truth. And it should be a connecting that there's plenty of room for all. And so as you do come together, as you do connect, and you want to build resilient teams and you bring people together for listening, put some guidelines in place that we want to listen to your experience, but not your judgments or your assumptions or your accusations. Because I'm in so many groups, when I ask for their experience, they want to tell me who failed them and how they were failed. And I try and bring it back and say, your experience was one of feeling failed, because that's a feeling, but so many of us want to intellectualize our grievance or our feelings into grievances and add story. I didn't have what I needed. This means that leadership didn't care. And so bringing people to connect in softer, gentler ways where we can give benefit of the doubt to everybody involved, and we can forget about the blame and just imagine what great would look like and how we can make that happen. So I want to end by saying thank you to all of the folks in healthcare. I'm doing a lot, not only this week, this month, but all year. And I'm excited about what I can bring to the table. My new book is a lot about personal stuff, what I can bring to the table to help people get really good at their own mental health and their own practices. But as you're bringing people together, just know that honoring them, thanking, showing gratitude, naming it specifically, listening for what it meant to them, fantastic. But let's honor people by going one step further. Let's mine this experience for learning and growth. I want it to fuel the learning we have. I want it to fuel us curating a whole different way to move forward together. Let's not waste what's happened. And that's really what people want, is they want to know that it wasn't for naught. It wasn't for nothing, that we don't just quietly go back to the way it was and pretend we can't unsee what we've seen. And for all of us, instead of just jumping in and coming up with what others need to do, that we really ask ourselves, what's something that I can do? How can I grow and be a changed person out of this? And a lot of that growth comes from undoing and admitting that so much of what we think we know, we don't know, including the experiences of others, building a container big enough to house all of it, rather than trying to keep our same container and exclude things that don't fit, changing the size of our container to be able to house more of it, and really ending those conversations that were exhausting us and beginning new conversations that have a lot of hope in there. So usually I ask you guys for a lot more input, but I want to come on and give you a little preview of some of the things we'll be talking about tomorrow, and to have this recorded for all of those people in healthcare that I absolutely adore. Thank you, thank you, thank you to all of you. I know lots of you are supporting or have family members of people in healthcare. But let's make sure, get out there on social media, do your shout outs. Let's love these people up. They certainly have answered the call to greatness for us, and we're not out of this, but we know a lot more about this. So be well and be safe.